Today I'd like to speak about MGeneRx. This is a company that's focused on delivering solutions for early identification of newborn genetic syndromes and creating a program to help deliver clinical care at the point of contact with these particular patients. This is our general disclaimer stating that these are forward-looking statements that could change materially in the future. Our mission is primarily focused on using AI to deliver better health outcomes, and we have more applications behind this, but I believe this has the largest impact on children globally once it goes out commercially. Our vision is detecting genetic disorders using artificial intelligence, and that's our primary focus. This is our team. We have a number of experienced individuals in our management advisory team. We have some of the top geneticists in the country, as well as the top experts in facial recognition and informatics, as well as individuals who are pediatricians who have worked for the regulatory agencies, and also executives within seasoned executives in marketing and financial. Also, our chief financial advisor is very experienced, as well as our legal counsel. So what is the problem we're trying to solve? There's 8 million newborns born worldwide annually with genetic syndromes and chromosomal abnormalities. 3.2 million are disabled for life due to lack of treatment and lack of skilled care. And then 2.8 million die within the first month due to lack of screening. As you can see, that one of the biggest problems is really the access to pediatric geneticists. If you can just look at the table itself, if you really look at the table overall, you can actually see that, the amount of medical geneticists here is very limited. So it's just not an issue for the US, it's an issue for, globally, worldwide. So what is our solution? Our solution is focused on helping healthcare workers screen newborns and young children for genetic diseases in a faster, more accurate, non-invasive way. Our technology was developed, specifically focused on, aiming towards creating solutions using AI. We've been published in Lancet, which we had significant due diligence. So if anyone worries about due diligence, we had a lot. And so you got some of the top KOLs, you've got some of the key editors, and this study that we published in Lancet was a result of 2,800 patients, and it showed 88% accuracy over 128 genetic conditions in 28 countries. That means it's got cross demographics, and it's got much wider screening than anything else that's currently out there. Our technology has been used in this prototype application. You can see it in use. It looks at the hands, feet, and the left and right profile of the face and creates genetic landmarks, and then creates a genetic dysmorphology probability of a case of genetic disorders. We've created a functional research prototype, which I'll give a short demo on. And it has 2 patents, and it also has code which is copyrighted.
And Nasser, this is Rosemary. Could you give an example of a genetic disorder that your technology could identify?
Noonan syndrome, Klinefelter syndrome, Down syndrome, obviously, and I can list off the other 128 once the list. But basically, a real very large cross-section of the most probable genetic disorders, common genetic disorders, as well as some of the rare ones. And statistically, some of the rare ones only have 10 patients, and so it's kind of very interesting, and this type of tool is probably the only tool that can detect that. And it's been used in like 6,000 cases. We've actually got a prototype that we use in a laptop. This doesn't actually reflect the current product because it's been upgraded, but this is the one I actually can show as a demo because that one's currently in development.
This is the software, right, that we have for analysis over here, and I prepared selection of syndromic and non-syndromic kids, to show you a little bit live how this works. Even on our laptop, this runs in a matter of seconds. This is a kid that comes from a clinic in Argentina, and you also see the pictures are not perfect because we use again a lot of quantitative imaging to help us correct for some of the challenges that we have with the pictures. It's difficult to have a kid always sitting perfectly, right? They turn a little bit their head. So we see our model identifies the landmarks correctly, even if the head is tilted. And you see, we have a probability of 99% on this child. So again, very high. This is a child that, you know, has Cornelia de Lange syndrome. I think she's a little older. Right? Should be in the range before, but not so obvious, I think, to the eye. At least I'm not able to tell by just looking at the picture if the child is or not. Again, we identified the landmarks. She had a genetic test, so I mean, we're sure of what we're showing you here. These are all high probability of about 98%. Here is a Caucasian kid that looks very, very young. Actually, the image here is a little blurred, not so good, but it identifies the landmark without difficulties, and it gives a high probability. We can do more. I think this gives you some indication. We also have some, you know, healthy kids that this is, for instance, I wanted to show you this one. So this is a child that came to our clinic, and he's the brother of a child with a genetic condition. And if I remember correctly, they are twins. And one has a condition, the other one does not. And so these are always interesting cases for us because, no, they look alike. They look different also, but they look alike. When I got pictures from them, I didn't know which one was which. But you see here, probability is 1%. So that's again that U shape. That's what we want.
So as you can see, that was the actual application in action, and all we're looking at, it's ready to go. Just on the minimal viable product, just to get it out there, and then we'll develop it in multiple iterations. But the bottom line is it needs to be out there in detecting genetic disorders in pediatric patients because there's nothing like it currently. And so if you look at the target market size, you know, it's 450 million. You know, if you look at the North American target and growth of 8.4%, emerging countries, you know, European in Europe, you know, 6 to 8% developed, 60%, you know, rare disorders in up to 60% developed in childhood. And also, you know, it's got a strong return of investment at the same time. You know, if you really look at the solution matrix, ours is instant, it's a low cost per screen, it's non-invasive, it has 88% accuracy, it's accelerated diagnosis, it significantly increases the time and speed to screening, and its application is simple. And then over time, over a 5-year time, there's a trajectory of increase that we're predicting, and we're assuming 30% of all the gross revenue, hence this lower profit, is going to be put back into sales and marketing cost because that's the largest amount. And so with this, you know, we're particularly looking towards raising, you know, 3 million because we don't want to keep on going to the raise, and 3 million will get us to commercial and out to multiple countries. So it's a very small amount for such a key product, and marketing costs, you know, individuals, servers, and, you know, the developers are really key. And we've you know, started to raise capital right now, and we'll have developers on board shortly. But we look forward to, you know, definitely talking to anyone interested in investing.